All right, we're right at 12. Are you good?
I'm good.
All right.
Thank you.
Uh-huh. Hello, everyone. Hi. Thank you for coming to our December book sandwiched in. I'm Dina Viviani, the programming librarian here. I just want to start with a couple of housekeeping announcements. First, if there is a need to evacuate the building, the door on my right, your left is our closest exit. For anyone using a hearing aid, you can click into our induction loop system as needed. And to make sure everyone can hear and participate, when we have time for a Q&A at the end, I'll bring this microphone around, so please wait for the mic so you can comment or ask questions. And we, of course, want to thank the Friends of Brighton Memorial Library for sponsoring our BSI series. They do have a pop-up book sale happening. It will be in this room on December 13th and 14th, Saturday and Sunday, and it is $1. Starting at $1. Get your gifts for $1. Gift wrapping? Gift wrapping. So please stop by next weekend to help support these programs. And did I have another thing? Oh, and please grab a program flyer. Our December programs are out. They are listed in our blue flyer at the back table. And we do have one copy left of today's book if you'd like to check that out. Otherwise, feel free to check at the info desk if you'd like to put a book on hold. All right, and with that, we have a slight change of speaker than we had advertised, but we are happy to announce Dr. Lighthouse. So the lovely Dr. Gardy, she had a conflict, but she said, fortunately, I have the perfect colleague who I can send over. Nicole Lighthouse is an adult psychiatrist, originally from Rochester. She practices in both ambulatory outpatient care at Genesee Mental Health Center and is a consultant with the Integrated Care Team. Some of her greatest joys in her roles include multidisciplinary team-based approaches to care, collaborative education for patients and their families, and mentorship for our residents and students. Her interests in practice include, but are not limited to, culturally competent and sensitive approaches, humanitarian efforts and advocacy, biopsychosocial models of care, integrative psychiatry, the intersection of behavioral health and public health, and diminishing misconceptions within the field of psychiatry. So let's have a warm welcome for Dr. Lighthouse.
Thank you. Thank you, Dina. It's an honor to be here. And just thank you, to my supervisor, Dr. Gardy. And it's an honor to be here on her behalf. And so I welcome really this joining together as a conversation, as a community, and the whole world, each of us, families, society. Emotional well-being is so important, and it's truly a part of our whole well-being. And I think that's a big part of my role that I'm very honored to serve in every day with my colleagues. And what I just find so captivating about this book, Lisa Genova, she's a beautiful writer, and she captures, as a fictional novel, just so many important aspects of emotional well-being, the challenges that can surface for an individual and the whole family and the community. But what really drew me to this book is just about the misconceptions about emotional well-being and just really reinforcing my role, our role as a medical community to help with that education. And so is there anybody that has not read this book? Because I'm happy to. Okay. So this book is really, it captures the life of a young woman named Maddy. And so Maddy is young adult in college. It really describes her day-to-day role. She's a daughter, she's a sister, and really just general day-to-day work, her commitment to her college courses. And then it describes there's different issues that happen in her life that lead her to being hospitalized, essentially. Really having challenges in college, being hospitalized, and then really just the chapters continue to explain like what she goes through to learn more about her condition, and as her family learns about her condition of bipolar condition, and really her own education and her family's evolution of her condition, and really how to help support her, how to advocate for her. And she also really learns to understand like what her own talents are, what her joys are. And there's a lot of challenges along the way, because her mother, for example, there's an association with a lot of Maddy's talents and the things that she wants in her life and enjoys in her life. And her mother is fearful of her choices, because is this my daughter Maddy's choice, or is this the condition? Is there a concern for decompensation or like worsening of her symptoms, or is she really thriving like in her role? And so there's so many different, poignant, heartwarming, but also heartbreaking points in the book. And so I'm going to stop there for any questions, anybody who has read the book, or any thoughts on like what I've discussed so far. I want to make sure to take frequent breaks so that we can have more of a conversation. Please.
I did read the book.
Yes. Okay. It's okay. Yes. Yes.
I'm not really familiar with bipolar.
Sure.
And my question is,
Yes.
it seemed like her symptoms were very extreme. Were they
Sure.
typical, or because this is a fictional book, were they more extreme?
I think that is a fabulous question, because as a book, I think that there are a lot of different areas in like media and books and movies that can dramatize certain symptoms, because you're right, there are different time periods when they were trying to like emphasize like the different criteria for bipolar disorder. But to answer your question, it's not textbook necessarily, because anybody who may experience the condition of bipolar, and there's different categorizations of a bipolar condition. And that can present in a number of ways. So you're exactly right. And I think that's where my passion and desire to educate is that not all symptoms are equal depending upon who the person is, what their experience is. I think the book does a good job, a really good job in highlighting too that there's a family history, and there's different risk factors and symptoms to look out for, the age of like symptom manifestation. So I think there's definitely an accuracy in some of the symptom presentation, but I would not define that as this is exactly how it looks in every person. So it's a fantastic question. Yeah. I hope I answered your question.
Yes.
Okay. Go ahead, please.
I've worked in community health in another lifetime.
Yeah.
I can give 2 examples.
Yes.
The one gal came to work one day, and I don't remember now
Mm-hmm.
exactly what to work with, but inappropriately came dressed as a clown.
Okay.
For no reason.
Okay.
The other example I can give is
Mm-hmm.
when I was assigned to course in jails.
Mm-hmm.
You could look at the man's checkbook and see the development.
Okay.
Because the signatures went from his regular signature
Mm-hmm.
to quite exaggerated.
Okay. Thank you. And that's also a great example. And so I will piggyback onto both of your questions and examples, because with any condition, within the diagnostic statistical manual for like emotional conditions, there's criteria, and you'll see there's like a minimum amount of criteria that might lend to the diagnosis of a condition. So somebody might demonstrate certain symptoms, but not all symptoms. So that's again, going back to, that's a really great and appropriate question of, is this what, we're seeing, or is this a manifestation of just like the person's regular character? And I think that's another really important, critical part of our roles, wanting to help with improving like function and quality of life, but not changing like the essence of who the person is, because that's critical. Yes.
You mentioned that there are levels of this. Could you explain bipolar a little bit more?
Absolutely. No, of course, absolutely. 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 So currently, examples of potential criteria include, again, one of a number of things. It's a time frame, like a certain time frame where somebody might demonstrate like elevated mood or irritability, energy level might be higher than usual. There, examples could include so that's a great question, and yes, that like what I'm describing has been described as that beforehand. But I think that that's also a really great follow-up question, because that term can be used a lot incorrectly, because there's a lot of different ways that, again, Maddy presents her character in the book. And she might have a moment where she's more irritable. She might have a moment where she's demonstrating an impulsive or an unhealthy decision for herself. But that alone doesn't that doesn't describe a diagnosis. So excellent question. Yeah. Yeah. Go right ahead.
When I was reading the book, I think her diagnosis was bipolar 1, is that right? Like, so what are the different categories, I guess?
Absolutely.
I read a little bit about it as I was reading the book.
Sure. So examples are like bipolar 1 and bipolar 2. Like, those are just two examples for right now. Really, there's two general but major like differences. With bipolar 1, it typically is categorized as a greater level of severity. And there's an increased risk of potential like serious concerns and risks that require more monitoring and more care, possibly, but not necessarily. It really depends on the situation. There's also, between bipolar 1 and bipolar 2, it's really, there's this general time frame that symptoms, like an episode or like an event, might last for. So 1 week versus like 1 week or more versus like 4 days or more. So time frame matters a lot. And there's a whole host of other factors. For anybody who's read the book, so there's a lot of different chapters that show text messages between like Maddy and her family. And, her mother has like her like scheduled text messages to Maddy. Have you gotten your sleep? Have you gone to work? Are you home safe? Did you take your medications? Proper nutrition and really proper sleep is huge for anybody. But like in this particular book, for like the condition that Maddy was experiencing or is experiencing in the book, sleep is so critical. But really, structure to everything is critical. Yeah. So, yeah. Go right ahead.
Is bipolar what used to be referred to as schizophrenia?
That's a great question. I don't recall or think that that they were synonymous. There's several different conditions that have been described or can be misconstrued, I guess is the right way to put it, as one or the other. But there are important potential similarities that can make it really difficult to differentiate. Like thought process. That's a perfect example, which can be disorganized or just not clear with either condition. So that's a really, really big point, and it's a great question. And so I think that that's another really important point of where there can be a misconception or a stereotype or a stigma. So, yeah. And again, going back to the point of the needing consistency with sleep and appetite, all of these things are critical, in general, for well-being. So, go right ahead.
What is the age of onset?
That is a great question. Excellent question. Age of onset. So more commonly in early adulthood. There are incidences of later life occurrences, but more commonly in early adulthood. So.
Well, what is early adulthood? 20?
Yes, 20s to 30s.
But that makes a lot of sense, though, because that's when you start being on your own and you're not so great with your nutrition or with your sleep or with any kind of self-discipline.
Right, and there's a lot of questions to ask and things to consider, other health conditions contributing, like hormonal contributions. There's so many things happening in the body, and then external environmental stressors that really play a role, could contribute. So, yeah.
Is there a difference between male and female onset time and
That's a great question. That's a really great question.
Could you describe briefly somebody? If I walked in and said, a lot of our friends are dying. I feel like I should die too. Maybe I'll help myself die. Now, I presume that's diagnosed as depression. The other end would be, I'm going to spend all my money. So before I die, and so I'm going on this trip and that trip and theirs. And is that manic depression or is that normal life adjustments?
So that's a great question. I want to be able to answer both questions. So, I believe it's approximately similar with some variation between men and women, and depending upon factors too. But I don't recall the exact cutoffs of age. I don't want to misspeak with that. So I'll have to identify that more for you. But so for your question, what you described is not necessarily isolated to one versus another condition, because there's so many potential variables and emotional stressors that might contribute to that. So, yeah. Did you have your hand up? No? Okay. Now, is there any chapter or specific area within the book that anybody wanted to discuss more? I know chapter 17 for me, I've dog-eared almost every page in chapter 17, because this is such a critical all the time, or I highlight things, but just there were so many heartbreaking conversations and thought processes. So conversations between Maddy and her family. And this is really after her first hospitalization. And I think it really does a great job capturing the many emotions and fears and challenges that families face. Like, how do I support my family member? How do I educate myself about like this condition? What do I do to help? And I think so many times, like, families, loved ones, supports have their own like fears and uncertainties, and I think that it's hard to know like how to translate and how to communicate those concerns, right? And I think that's a big part of, again, our role in education, um, for various like emotional concerns that might come up. And then, as the book continues, with conversations between like Maddy and her family, again, there's this evolution of like her family echoing like, I want you to be safe, I want you to make safe decisions for yourself, but also recognizing like they have to learn to trust Maddy and recognize she needs to be able to like live her life and make like her own decisions, which is there's a lot of challenges with that, that balance. So it was just very that was a powerful chapter, but the whole book is powerful for various reasons. So
I haven't read the book yet.
sure.
Do you recommend reading the book?
I do.
Or is it too deep for
That's a good.
who want to really deal with this situation again?
Sure. So that is a really good question. I think that it's the type of book that I welcome anybody to maybe start reading and see, am I okay? Like, am I, okay to continue reading this? And I've had to put it down myself a couple times because there are some very powerful components of the book, very challenging components, and I think that that's absolutely okay, to recognize like, I want to continue reading this book versus like, okay, I have limits to like this chapter and I'm going to put this down right now. Or maybe this is for a different time. And I think that that's our relationship. I know that we're all avid readers and we all just really want to seek knowledge from different books, but I think some are either more accessible than others, and some might take time until we're ready for that journey of that specific book. So it's an excellent question. Please.
Can someone have manic episodes and not have depressive ones, or do the two go together?
So typically you see more depressive episodes with bipolar 2, but you can absolutely have depressive episodes too with bipolar 1.
Manic without becoming depressive?
Yes, like you can have a manic episode. Like there is, let me rephrase that. There can be isolated mania or hypomania episodes or events versus depressive. Like they can be like very separated. So.
But do you still have both? Or I think your question was, can you just have the manic without the depression?
Yeah, that was my question.
So typically you have, it is possible. It's really difficult to explain because it's more complicated. So it just, it depends on the situation. So it really depends. And I think too, for a lot, I think what the most important answer to that question is, what symptoms are really affecting the individual in their lives? And sometimes that might be really what they readily discuss. And if they are experiencing other symptoms or concerns, that just might not be a concern for them, if that makes sense. Like a lot of my questions during my day-to-day practice are, what are your goals based on, your functioning, your quality of life? Because that is one of the most important things to be able to understand, like how to help one particular individual. So I know that wasn't probably wasn't the clearest answer, but it really depends on like the case and the situation, if that makes sense. So, yeah. And I mean, for the book and what Maddy is experiencing, like she experiences both like clear-cut symptoms of mania or more hypomanic symptoms and depressive symptoms. But it's also tough too to identify because, she describes a lot of her experiences with the medication she's taking and how that also affects her emotionally too. And so there's education in the book about like really working like with her care team and like with herself and her family to identify what works best for her to help her with her quality of life and her well-being and her function. Go ahead.
Could you address family, what families go through?
That's such a great and important and difficult question. I think first is really a combination of some families might go through confusion, trying to understand a condition, trying to understand like what the warning signs are, because that may not have been like apparent. Fear. So there's a whole host of different emotions like any one particular family may go through. There may also be relief because like now we all understand and we can finally help our loved one and we can finally help our family member. So a lot of times the whole knowledge is power. It truly is, because then it's like now we have the steps, now we have a more of an understanding of how to be able to help our loved one or our family member. And so it can really vary depending upon the situation. I think too it varies depending upon how much one particular person has been like exposed to or educated on like a particular condition. So I think that response and that communication, that support with that family member can also depend on how much is already like known, if that makes sense. And I think, so going back to, Maddy's mother in the book, she understandably responds with fear. And I think a lot of her instincts and reactions initially came from because her previous spouse had experienced the same condition. So from her perspective, she's like, I just want to protect my daughter. And so she was coming from a good place, but the book demonstrates an evolution of how do I preserve my relationship with my daughter in a healthy way and help her to live her life independently and trust and place trust in her, but still, I'm still her mom, and that's not going to change. And so I think that's what a lot of family members go through. Yeah.
Is there a genetic basis to it?
Yes, there's so if there is a family history and a genetic correlation, that increases the risk level to a degree. So yeah. Go ahead.
One of the issues that Maddy had was
Yeah.
When she was on her meds,
Yeah.
especially in the beginning, she thought she was herself.
Correct.
And lost like the key parts of her personality
Yes, right.
that were important to her.
Mm-hmm.
And when you hear about people, like people that are back out on the streets because they went off their meds or whatever,
Mm-hmm.
how is that addressed with, well, in your profession and by families to help people?
That's a great question. It's
negotiate or navigate that.
That is a very such an important question. A lot of times, just like in the book, it takes time to really identify what will help the person, but also it's always this risk versus benefit conversation, like with everybody that we care for, about How much is this helping you versus like, how is this sitting in your body? Are you okay with that? Are the side effects to the point where they're not tolerable? So when I at least my conversations with those that I care for, it's that question of quality of life and function. It's both about symptoms, treatment, and side effects. Because if the side effects are too much for somebody to really engage in their life in the way that they wish to, then is this really good care? Because you're right, like if somebody stops their medications, that's an indication to me that we need to have another conversation about what will work better for this person. And so we really need to open our minds and listen and lean into that conversation. So
How does it originally get diagnosed? Because in the book, it was Maddy had these incredible highs and then get arrested and then
Right.
eventually got to the hospital where she
Right.
was physically diagnosed.
Right.
Because some of the way she showed herself in the beginning is very typical of teenagers, the way she was rebelling, the way she dressed.
Yeah.
She didn't want to be at the country club with her mother.
Sure. That's a great question. So it depends. It depends on a lot of things. So people don't necessarily have to experience like those like really devastating situations until a diagnosis happens. A lot of times somebody might notice like, I'm concerned about you, are you okay? And then help that person right away. Some individuals might recognize within themselves like, I'm not feeling okay, and get help for themselves. And I think that's also another part of the book that I want to separate, because sometimes books can. What was that?
It's a little over the top.
Exactly. It can just really magnify issues in a way that don't appropriately represent how it actually happens. It's not to say that those things don't happen, but that's not an appropriate representation of what always happens. So, yeah. Go ahead.
In New York State,
Yeah.
there's a phone number to call if you think somebody is getting suicidal or so depressed.
Mm-hmm.
And they've made quite an issue of it with people that have been put in war situations and come home and they're trying to adjust to not being a person that has to kill other people.
Mm-hmm.
Part of their job. But the average person,
Mm-hmm.
if you're concerned about somebody who's an adult,
Mm-hmm.
even as a parent, you can't make that phone call for them and get them help, or you can't force them to go to the emergency room to seek help. And I don't know how you feel about that as a provider.
Mm-hmm.
There's a long wait list when you voluntarily call the helpline and try to get a referral to somebody local who you can sit down with. Is that still true? It used to be true years ago. I don't know about now. Is it getting easier to get help?
That's a great question. So I do feel that there are more resources now, and more just in general, resources, avenues, more specialists than there were like maybe years ago. And so I do feel like that accessibility is improving. I know that there's a lot more, our world needs to do to continue to improve accessibility in a lot of ways. I'm not certain about, wait lists for like a particular like helpline, but it's a great question. So I'm hopeful that it is at least more accessible than it was in years previously. Yeah.
This is fully accurate, but
Mm-hmm.
if you have concerns about someone, can't you call a number for a mental hygiene arrest, and someone will come out within 24 hours and they will evaluate that person for imminent risk.
So there is a number that helps to improve accessibility for any like more significant severe emotional concerns. 988. Yeah. So.
And somebody does come out and interview the person you're concerned about?
I think it just really depends on the situation, because sometimes people do call and they need to talk, and sometimes they can talk through what they're experiencing with a specialist. But there is essentially like an order of operations. Like if there are more urgent concerns, like I understand that there are outreach efforts, like depending upon the location. And so I understand that over the past couple years that has improved, with the initiation of that number, separating that from like 911, even though they're both important numbers to know. So, yeah. Yeah.
Can I ask if what are the medications that say Maddy was prescribed, and how do they work? Like, what's the physical or biological science of what you're trying to achieve with those?
Sure. So that's a great question. So the two medications, well, there's one medication at the beginning that's not for bipolar disorder, and they identified that that was one of the reasons for her first break, the first just series of events that she went through before her hospitalization. One of the medications that the psychiatrist in the hospital placed her on was lithium, and the others later in the book, I believe, is called quetiapine. And so those both help to provide what's described as kind of a more even or stable mood, essentially, for somebody. They can also help with symptoms of depression. And so the goal was to help to essentially bring down, again, what I had mentioned earlier with the criteria, those high levels of energy. Just really, she was, before she went to the hospital initially, after she was treated with the wrong medication, that led to her doing a lot of things, being like really productive, and then leading to more high risk decisions for her health. And so the psychiatrist had then, decided, let's try you on this medication to help, essentially bring down that elevation of mood, that energy. And again, the hope was to be able to identify something that could work well for Maddy to help keep her healthy and to help keep her safe. But as we learn throughout the book, it's a work in progress to help balance care for her, but also like symptoms and side effects. Great question. Thank you. Yeah.
I think part of what's frustrating for Maddy,
Mm-hmm.
or like anyone in real life, but is how long it takes to see if it's working, right?
Absolutely.
Build up, and then
Yep.
how do you know how long you keep her on and take her off? And
Absolutely. Yes.
not a quick fix for her, but she's like, gotta wait and see if that works. And if it doesn't, how many weeks until you try again and see if that is gonna work?
I know. And that's another, I think, difficult part about our role as educators. And in society, I think there is this newer mindset of like wanting that quick change to happen and wanting things to be okay right away. But again, there's the really difficult, challenging things that all human beings like need, is that, again, consistency, that stability, consistent sleep cycle, consistent nutrition. There's a whole host of other things, including, the medications for Maddy specifically that were so important, that are actually really foundational. Yeah. And then really learning just the tools that she needed to really understand, how do I manage these, more significant emotions that I'm feeling? What outlets are healthy? With her writing and the comedy, like that was a really important, and it turned into a healthy outlet for her. And we see throughout the evolution of the book that her family understands and eventually supports her.
This is more of a comment than a question, but
Yes.
you talked about needing to put the book down, and I remember now.
Yeah.
Because she made such bad decisions, one after another, and watching her,
I know.
witnessing a fictional character.
Sure, right. I know.
Like that
I know.
was really difficult.
It
I
is.
had to just put it away.
Yes.
So I can't imagine
Yes.
what it would be like to be a family member and witness that and not
Right.
be able to intervene or
Absolutely.
do something about it.
Right.
It was tough.
It was really difficult. I mean, because it was, and it being on a holiday too, that made it that much more challenging. I know before the first hospitalization, it wasn't the holiday, but that it was on Thanksgiving that it happened, and it made it that much more difficult, I think, for her and for her family. So, and I appreciate that so much.
Yeah, when it's fiction, you just shut the book and put it away.
Exactly. I know. You're right. You're right. Yes. Yes. And it's interesting because obviously as we all love to read, we have these, it's like we have this connection that we develop with the books that we read and the characters. And their personalities and their joys and the distress and everything that they go through. And I think that's such a big part of what really draws us to reading and learning more. Go ahead.
Just to add,
Yes.
to what you just said, I find these Genova's books very compelling.
Mm-hmm.
Brings you in. It's like you're reading nonfiction.
Yes. Yes.
Things that you never knew about that sound like they could be fiction. Like there's that story of hers that he neglected, where I had never heard of that syndrome.
Yeah.
And all of a sudden it's like, it sounds like a fictional story, but
Yeah.
it's totally based on what happens.
Right.
This is what I specifically appreciate about her writing.
Same.
She makes things into a more palatable,
Mm-hmm.
digestible story that combines fiction and nonfiction.
Right. She does. She does. I agree with that completely. Yes.
Yeah, I kind of want to repeat what Jackie just said.
Okay.
But just made me think about what I liked about the book
Mm-hmm.
is it takes this disorder
Mm-hmm.
and it like teaches us about it, but not in a textbook boring way.
Right.
It teaches us about
Right.
it like with these. Well, they're not real people, but they feel like real people, and so it helps us to understand the disorder better, and also gives us a chance to talk about it.
Yes.
Because I mean, I think even though I think we hear a lot about mental health, like challenges with mental
Mm-hmm.
health these days, I still don't really think that
Mm-hmm.
we, like, in society, I don't really think that we're really talking about specific disorders that much. And so the book, helps us do that.
You're exactly right. I think it's interesting because I think of the words of sympathy, but really empathy, because it's like you're able to be in the family member's shoes and in Maddy's shoes, and you feel that. You feel what that, you can only imagine what that could be like. And I think that's also what makes this book so powerful. And I appreciate this so much because it gives us a foundation to have these conversations that are so critical. And to be able to think about how can I continue this discussion? How can I continue learning? What more can I be reading and thinking about and doing? So, such excellent points.
So is this a book that you as a potential instructor of future mental health therapy people would recommend?
I would.
Only after they graduate. Because college is such a difficult time for everybody.
It is.
Add
No. It's a great question. I think going back to our discussion beforehand, I think anybody who is interested and curious and thoughtful and wishing to learn more, and just really like any other book that anybody is interested about emotional well-being or the challenges and that education, I think it's really starting that relationship with a book, starting that journey, and I think recognizing what your readiness to read, and then if you need to disconnect from it. I'm imagining that, um, at Lisa as a writer, anybody who has also written, I'm sure we have writers in the room as well, that relationship with the writing, there could be a lot of like powerful content and emotions that come with that. And I'm sure that she and other authors that have written need to take a step back, right? Because it's very, very powerful material. Somebody had a question. Go ahead.
My understanding of Lisa Genova is that as a neuroscientist,
Yes.
she knows the condition
Yeah.
that she's writing about.
Exactly.
But also, I believe that she goes and interviews families and individuals with the condition.
Yeah.
I'm pretty sure that the book Inside the O'Briens about Huntington's,
Yes.
I think
Right.
a family in Buffalo
Mm-hmm.
was one of the ones that she interviewed.
Right. Right. Exactly. Exactly. And I understand from reading her books, it sounds like when she started to write this book and share that she was writing, just there was a lot of communication that she received and like gratitude about writing this book, because it's just really a topic that many are affected by and wish to learn more about. So, and she's a very powerful writer. Go ahead, please.
I think there have been many excellent memoirs written about schizophrenia.
Mm-hmm.
And I just speak to that because both my sister and I, who graduated 10 years apart from each other, had a very close friend, each of us, who was diagnosed at 21 in her senior years of college with schizophrenia. And it behooved my sister and I, who wanted to continue the friendship, to learn as much as we could about the disease so we could have this valued person in our life and understand what was going on. No, we did not become a psychiatrist, but the more awareness we had, the better the friendship would be grounded. Those two friendships lasted for decades until each woman passed away. And no matter, I worked with kids for my whole life. So many were diagnosed with so many different things. And when they didn't take their meds, let me tell you, I knew it. I would call a parent and say, who did you send me today? They would say, oh, you found out I didn't give you meds. I said, oh yes, I'm quite observant. So that wouldn't happen more than once. But, I don't blame them for trying because, nobody wanted to keep their meds, keep taking their meds all the time, but that was the only way they could learn. But if somebody with a disorder is in your life and you value them, then you have to value yourself and find out as much as you can so you can be a support person. You're not there to cure them, you're not there to change them, you are there simply to understand them and to support them and hold a hand out and say, I'm here.
Yeah.
That's it.
Thank you. Thank you for your advocacy of that. Yeah. And it's a big deal. And I think that's something that, again, it goes on to everybody, just how we can all continue learning and growing from one another, from individuals that we support and we care about, because that process is ongoing, regardless of experience and background. Because again, I think the world has progressed in a lot of really good and healthy ways in terms of understanding emotional well-being, the growth, the help that's out there, and the challenges. But we need to continue to be progressing, and the best way to do that is with one another and having these conversations. Yeah.
That kind of leads me to
Yeah.
two other questions, if you don't mind.
Of course.
One is there a lot of resources
Mm-hmm.
being or put into the research for even specifically bipolar 1, bipolar 2? And then in the book, as our example, how should somebody respond? I mean, I can understand why Maddie's mom, kind of jumped on, like she knew something was wrong with her daughter. She thought depression, right?
Mm-hmm.
At first, or so she brings her to the doctor, and they
Mm-hmm.
put her on whatever med. What should or what would you advise
Great
loved
question.
ones to do that maybe Maddie's mom did not do,
Mm-hmm.
or Maddie's siblings if they recognize this behavior? What would you advise them to do maybe that Maddie's family did not?
Great question. So number one was the first question about, are there like both research and like resources specifically for bipolar disorder? Yes, there are. I think it just depends on what is most helpful for the individual seeking the information. Because like I'm a book person. I like paper. I do research online. I have plenty of research articles. There's a lot of different medical resources out there. Lots of books. There's for individuals that prefer like their telephone. There's so many different, I think, ways to access resources, which is becoming more and more rich. It's just like really being careful and researching and understanding, where am I getting this information? Do I trust this information? Checking maybe with a trusted source or a provider. Do you trust this? Should I be trusting where this information is coming from? And then the second question is, so again, a lot of emotions can arise with family supports in trying to understand like how to support somebody. I think it's really how everybody has presented their own questions, that curiosity. How can I help you? What help can I provide right now? What can I do to help support? Like trying to find like a safe space to do so. Diminishing judgment, diminishing shame, trying to stay calm, which is difficult. It's difficult when we're afraid to stay calm, right? And trying to help that person feel as safe, as comfortable as possible, like when asking these questions. Because they might be afraid of a lot of things. They might be afraid of like guilt, judgment. They might have a lot of their own internal emotions that they're trying to process too. So it's recognizing that I need, to try to have a calm discussion and really try to listen, which is always so helpful. So I hope that helps to answer that question.
Yeah, and because of like the early onset,
yeah,
happens, the people suffering might be so young, but they don't know any different.
Absolutely.
Like you said, there's so many other factors, schedule changes, different stress, hormones, whatever.
Right.
Your brain is still developing.
Right. Yes.
So
yes.
Would it be accurate in some cases to say that to expect the person with the disorder to recognize that they have this disorder is very difficult or is it more often going to be an outside person who looks at that individual and says, oh my gosh, you need help, rather than the individual saying, something's not right, I need help.
Right. So that's a great question. I think that, and that's a really tough intersection. That's a tough space, right? Like if the individual that needs help doesn't recognize or isn't ready to seek help. and then you have a support that may not know what to do and what to say. And that combination can be very common. And so I think a lot of times just a good, healthy, safe place to start is, it is also okay to say, like, I need answers. I need to learn how I can help you more. Let's go together to somebody that we both trust, provider, primary care, schedule an appointment, whomever is trusted and most immediately accessible, so that we can both learn together. Because sometimes, I mean, number one, it's always okay to not know and to need to seek more information. Asking for help is a strength. And I think that is something that we don't underscore enough in the world in general. It is one of the biggest strengths. And it's another way to be an advocate too, is to ask for help. So, yeah.
I resuscitated the microphone. I'm sorry, I let so much go by when people didn't have the mic. But I also didn't want to interrupt the flow of conversation.
Yeah.
Does anyone want to comment, questions? We've had, I think, a really great conversation. Had a lot of great questions answered and posed. Does anyone have? Somehow it's already almost 1 o'clock. Is there any last questions? Yeah.
Yes.
I'm just thinking about how Maddy's disorder affected the other people, the people she knew, her family, boyfriend, friendships, and I hope it's okay. So this woman here, she was talked about her own experience, how she was able to be there for her friend, and that's amazing. And in the book, I'm thinking about Maddy's boyfriends, and she had the first boyfriend, Adam. He seemed like a good guy, and he after her episode and after he knew about her illness, he couldn't do it. He couldn't stay with her anymore. And I had sympathy for. I mean, I think he was being reasonable. It was okay. That's what he needed to do. He needed to step away. This wasn't working anymore. And then she had the other boyfriend, Max, and first she was trying to hide it from him. And then eventually she revealed it, and he's like, yeah, I could tell. And then we had a divorce. And I just thought that was interesting and realistic.
Yes.
Very realistic. Very realistic.
Exactly.
And I think one time somebody said to me, there are no shows. And
what was that?
There are no shows. And,
yes, right.
I think the boyfriends, they responded in the way that was right for them.
Right. And I think that that's another such an important point, and I think such a great point to like summarize for the end or the conclusion of this discussion, because they were setting boundaries, right, for themselves. And I don't think that I can't emphasize that enough, how important it is for anybody like who's caring for, supporting others, one another, to know one's limits, know what your own needs are and what those boundaries are, to be able to care for yourself and the one that you're trying to support and care for as well, whatever that means. And so I think that that's a great example of like what they were both like respectively going through too, is trying to demonstrate care, but it's like I also have like my own needs too, and recognizing what that is and how critical self-care is for everybody. So
I think my biggest takeaway is, no matter who you are to a person who you see who may not be well, is to just reach out and say, I will go with you to the doctor.
Yes.
And we can go and learn and
exactly.
see if you need help or if we can help.
Right.
We often think like, oh gosh, they won't tell you medical info, this or this or this or that, but even just driving the person there, wait in the waiting room, anything, just to be there with a person. So.
Such a big deal.
Yes.
Yeah.
Thank you so much, Dr.
Thank you. It's been a pleasure. Thank you.
And please grab a BSI flyer if you want to see the other titles that we've got coming up. I believe we have that librarian, and our reviewer is going to be Henrietta Public Library Director Adrian Pinelli, talking about book challenges. So please come next month. Thank you, everybody.
It's been an honor. Thank you all for your questions. Appreciate it.